Afternoon, everyone. Welcome to this meeting on tips to preposition health products. As we were planning this meeting, we asked ourselves, how can we help you to continue improving how prepositioning is managed, the decisions you need to make, and how to balance the cost of holding stock with the benefits of having life-saving commodities at the right time and in the right place when an emergency or life-threatening situation emerge. So for this reason, we anticipate that you will benefit from an interactive and participatory meeting today. We will explain later how it will work. And we also will be recording this session for those that are not able to join. And we will also share the presentations of the speakers after this meeting. So my name is Anabela Sanchez, and I am joined by my colleague Nora Quesada, and together we will facilitate this session. Nora, can you please introduce yourself to our audience?
Yes, good morning, good afternoon, and good evening. My name is Nora Quesada. I'm a Senior Technical Advisor and Regional Director at JSI, and I work in international development for several years now in the fields of reproductive health, system strengthening in supply chain, capacity building in different continents, Asia, Africa, and Latin America. And I'm sending greetings today to all of you from Bogota, Colombia, where I live. Nice to see you all.
Thank you, Nora. And I am Anabela Sanchez. I live in Guatemala. For several years now, I have been working as technical advisor on supply chain management, health system strengthening, and health advocacy, among other areas. So we're happy to have you with us and look forward to a participatory and enlightening session with you all.
Thank you, Annabella. Probably all of you know that will agree that leaders of the humanitarian response are those passionate people that are out there helping and giving hope to others in the middle of a disaster or an emergency. Delivering health products is part of that response to deliver hope and relief. And today we are delighted to have two voices from the field with us, two professionals who know how critical it is to have the supplies available to quickly respond to a humanitarian emergency and to find solutions that will provide immediate relief to sometimes people who may be facing a life-threatening situation. We welcome Eunice Okumu from Uganda and Bashir Yahaya from Nigeria. Please introduce yourselves, Eunice and Bashir.
Good morning, good afternoon, good evening. My name is Eunice Okumu. I work with the International Rescue Committee in Uganda. I do have 5 years experience managing medical commodities in hospitals, as well as working in humanitarian settings. I am very passionate about public health supply chains, ensuring availability of basic health commodities in the refugee settlements. I'm also working on improving health systems in supply chain management. Thank you.
Thank you, Eunice, and welcome. Bashir?
Thank you, Nora. Good morning, good afternoon, good evening, everyone. My name is Bashir Yahaya. I'm working currently with International Rescue Committee, Nigeria Quantity Program. I'm the senior manager managing the pharmaceutical supply chain in Nigeria. I have over 11 years working experience in clinical setting and humanitarian settings. I look forward to have an interactive session with you today. Hopefully we'll do it better. Thank you.
Thank you, Bashir, and welcome. And as Bashir said, as we get started, we invite everyone to introduce yourselves using the chat button. We want this session to be as participatory as possible. So please use the raise hand button when asking a question or making a comment. And feel free to interrupt at any time during the presentations that Eunice and Bashir will share with us today. So If when you raise your hand, we'll open up your mic so that you can participate and ask your questions and comments. So feel free to do so at any time of both presentations. So back to you, Annabella. You're muted.
Before we start, we would also like to take this opportunity to mention that this meeting is possible thanks to the support of the USAID Bureau for Humanitarian Assistance program. The program is implemented by JSI Research and Training Institute. The overall aim and objectives of this program are to develop training curriculum, including country case studies that we are currently developing also, and at the same time conduct supply chain capacity building activities, blended learning courses, share learning with regional and global communities like we are doing today, and also support partners to institutionalize supply chain practices into their policies and procedures. We also would like to take this opportunity to remind everyone that part of our support also includes a community of practice for humanitarian commodities logistics. Some of you might already be part of it. This group is part of the International Association of Public Health Logisticians. And this humanitarian commodities logistics group was established in November of 2018. Since then, we have approximately 500 members from 75 countries and with diverse backgrounds like humanitarian responders, health facility managers, country ministries of health, also implementing partners of USAID, and also UN organizations. So without further ado, I'll pass the floor back to Nora again.
Thank you, Annabella. In theory, one could think that prepositioning is an easy practice to implement. However, budget and supplies availability, among many other things, can be a barrier to deploy commodities in enough quantities and in a timely manner to ensure they are closer to the last mile where people are in need to use them. As we mentioned before, in this technical meeting, we will have the opportunity to hear from two voices from the field, Eunice and Bashir, on their experience implementing prepositioning and the tips and recommendations they have for all of us in case you decide to adopt this practice for your own programs. I would like to remind you that during the course of the presentations, you may raise your hand, open your mic, and ask questions and make comments at any time. We want this meeting to be as participatory as possible. So our first speaker, Eunice, will go first. So Eunice, the floor is yours.
Thank you, Nora. My name is Eunice Okumu from Uganda Country Program. I will be talking about prepositioning health products reaching the last mile. So just a brief crisis overview. Uganda hosts about 1.5 million refugees, and majority of these are from South Sudan, the Democratic Republic of Congo, and Rwanda. However, in July 2016, violence broke out in South Sudan, and there was an influx of refugees from South Sudan, and that is how the Bidibidi refugee settlement was opened in 2016, August. Bidibidi is considered the second largest refugee settlement in the world with a population of 239,096 refugees. So the IRC in Uganda, basically IRC operates in 5 refugee settlements. There is Bidibidi, Rainan-Vepi, Kampala for the urban refugees, Chiriandongo, and Palabek with the respective populations per settlement. The IRC in Uganda implements health services to include nutrition, reproductive health, mental health, and psychosocial support. primary health care, integrated community case management, emergency prevention, preparedness and response. And we have the WPE, which is women protection and empowerment, the general protection and rule of law, and the economic recovery and development. So 5 implementation areas. So the objective of the IRC humanitarian response in BDBD, IRC implements primary health care activities in the refugee settlement, operating 15 health centers at the level of a health center 3, with total consultations ranging from 30,000 to 35,000 clients per month. This includes the refugees and the host community. So about the COVID-19 crisis, at the height of the COVID-19 crisis in March 2020, we experienced the following challenges. There were limited stocks of PPEs from suppliers, and there were increased costs of the PPEs. There was challenge in distribution to the service delivery point, which is the last mile. And there was also a risk of counterfeit due to increase in demand. And at some point we were in a lockdown phase, so there were also restrictions in movement. So to avert the challenges faced in the first wave, we had to think about prepositioning PPEs as well as other pharmaceutical supplies. So hence we thought about stock prepositioning. So stock prepositioning is an important preparedness measure that enables fast and effective humanitarian response. It basically involves placing essential supplies near the point of planned use or at specific strategic locations for timely response in case of an emergency. So as we know, emergencies can be man-made or they can be natural disasters. So BDBD is currently our largest operation in Uganda, having the highest number of clients. It is also, however, easily accessible by our other 2 field locations, one in West Nile, which is Arua, and another one in northern Uganda, Palabek. So basically for this presentation, we prepositioned PPEs to include surgical face masks, the N95 respiratory face masks, sterile gloves, non-sterile gloves, coveralls, and surgical gowns. So as you can see on your left, we have the map of BDBD. BDBD is about 562 kilometers from Kampala, which is our central storage unit. And BDBD is also strategically located because it's easily accessible by Rhino Vepi as well as Palabek, which are also IRC operational areas. More to that, BDBD has 2 big warehouses, and as well as most of the facilities in BDBD are in permanent structures. So we have good infrastructure, I can say, in BDBD. However, to notice, during the rainy season, most of the roads are cut off due to floods. So what happened is we did procure PPEs and preposition them in BDBD in readiness for the second phase of the COVID-19 pandemic response, allowing us to have enough stock for the field teams when the second wave came up and lockdown was imposed. So basically, this is part of the process flow for prepositioning PPEs. First and foremost, we have to do a needs assessment. We did deploy a specific PPE forecasting tool to support us with forecasting, and we used a PPE burn rate, a PPE calculator. And of course, when you're doing the needs assessment, you also have to consider the items you're trying to preposition. If you're prepositioning cold chain items, you need to have the cold chain handling equipment. So for our specific case, we were prepositioning PPEs. And you also had to look at the available space for prepositioning as well as the appropriate storage conditions. So at the global level, IRC had preposition stock from its suppliers in Dubai. So we're able to draw down on this stock. Upon order confirmation, goods were packed ready for transportation in good time. To reduce on the lead times, documentation was sent ahead such that the goods are cleared pending receipt of the goods. In country, we did follow up with the regulatory authorities to ensure that the commodities were cleared in a timely fashion once received at the airport. And upon receipt in the central storage unit in Kampala, we did visual inspection as well as looking at the documents, did the verification, and then dispatched the items to BDBD. And upon reaching BDBD, the items were dispatched to the other locations based on their needs. Staffs were trained on the reporting. We had to report about PPEs every 2 weeks using a tool called a PPE burn rate calculator. This was used to monitor PPE consumption bi-weekly.
Eunice?
Yes, Annabella?
Just to mention that this process summarizes all the aspects and actions that you need to follow in order to preposition. I was wondering if you could tell us how long did it take for this process from forecasting, placing the orders, receiving them in these strategic locations, and finally delivering to the people in need?
So this whole process took max between 14 to 21 days to the last mile delivery.
Okay, thank you, Eunice.
Hello, Eunice. We have our first question from, and I'll allow him to speak.
Say that again, Daniel.
We have our first raised hand. I've asked him to mute, so.
Okay. Please continue, Eunice.
So this is just a slide showing the tools that we used. On my left, we do have the PPE calculator. This is for routine use, standard routine use. And then on my left, we have the PPE calculator for the isolation units. And this is just what we used as the PPE burn rate calculator, what we use to monitor stock. And it basically gives you a consumption of how much you have consumed over the past 14 days.
Hello, Eunice. We have another question. How long does it take to process clearance in Uganda port?
So in Uganda, on average, it takes us about 2 days when the items have been received in country. But the process begins when we have to get to the regulatory authority. So until the items are cleared, that's when the importation process begins. So once the items reach Uganda, it's usually about 2 days maximum, if it's not a weekend. So 2 working days. Thank you.
Very good. And the second question was regarding the PP calculator and its availability. Whether you could share that.
It's available. We'll share it. It's an IRC tool. It's available.
Okay, that's all the questions for now.
Okay.
So some of the benefits of stock prepositioning. In the first wave, we did run out of some essential PPEs like surgical face masks. However, I can say that in the second wave, we did not have any stockouts, even though we had more infections than the first wave. And at the lower level, we monitored PPE consumptions using the PPE burn rate calculator every 2 weeks, because I know there's usually a tendency for people to think that when stock is prepositioned, it's likely to be misused. So with the PPE burn rate calculator, we're able to monitor our stocks. And then staffs felt more confident and prepared to handle clients since they had sufficient PPEs. We were also able to save money since we bought stocks at comparatively fairer prices. The global supply chain team had negotiated with vendors such as IDA, Imres, Instel Pharma, and Meg. So this stock was available in Dubai. It was readily available. So in as much as prepositioning is something very good, it also has a few of its challenges, or these are things someone needs to think about when they intend to preposition. In the recent months, the COVID-19 infections have gradually gone down. We still have stock with us. However, the consumption rates have gone down, but we are monitoring the situation and we may consider donating to higher levels of care. We did also have limited warehouse space, but this was resolved by moving some of the items to the health facilities. As I had said earlier on, most of our facilities in BDBD are in permanent structures. So it is thus important to ensure that sufficient storage space is available and items are maintained at appropriate storage conditions. Then there was the risk of the misuse. This was averted with the use of the PPE burn rate calculator, where we're able to report on stocks every 14 days. And also on a monthly basis, we get stock status reports for PPEs per warehouse location, per facility. And there were also a few incidences where we did have long lead times for some items due to challenges with documentation at the customs clearing.
There are a couple of questions, Eunice. Samrat is asking if the PPEs need to be registered with the Medicine Regulatory Authority in Uganda, and if there are any standard specifications for PPEs. That's the first question, and you have two more.
Oh, so in Uganda, PPEs have to be, they're not really registered, but yes, we do notify the National Drug Authority when we are importing them, and we do request for verification certificates for us to bring them in. However, what they look at definitely is the certificate of analysis as well as the certificate of conformity. So for some of these items, we had to contact SGS that was able to do the process remotely.
Great.
I hope that answers it.
And the next question is, how does your organization pay for this? And do you charge back grants that use them?
Beg your pardon? Sorry?
Yeah. Someone is asking, how does your organization pay for the prepositioning stock? And if you charge your grants or donors for those costs?
So what happened for all grants that were written from around June last year to April last year, we've been incorporating a cost of PPEs. So we've been charging it on the running grants. But we also do have some unrestricted funds where we charge some of these costs.
Okay, great. And the next question is about the agreements that you have with the suppliers in Dubai. Are those a framework agreement, virtual stock, or more a wide stock? You already procured the stock and was only managed by the supplier? How do you manage to have the stocks available?
Yes, it's more of framework agreement, and this stock was already procured.
Okay. And how
so we procured and they did store for us. They did the inventory management.
Okay, they do the inventory management. Okay. And how does regular stock status report reduce the risk of misuse of the PPEs? If you can elaborate more on this.
So because with reporting, we are able to monitor how much someone had, how much stock was there at the beginning and how much is there at the end of it. But specifically with the PPE burn rate calculator, we are able to see how much stock was, how much opening balance was there on a daily basis. And then we're able also to trace back using the registers to see how much was consumed and utilized.
Okay, and was the supplier also responsible for stock rotation? Especially when you know, products were about to expire, in case they were.
Yes, they were, because we did use the system of first expiry, first out.
Okay, great. Thank you, Eunice. And okay, I think
There were a couple more questions that were popped into chat. Aya asked, what about the quantity that is included in donation as it is not fixed? I don't know if we need a little bit more detail on that question to answer it at this point. And then, well, yeah, another question is from Adele. Is there clear methods to calculate family planning commodities? The question was at 9:21.
Can you repeat the question, Daniel? Because
yes, is there clear methods to calculate family planning commodities?
Oh, family planning commodities. Yeah, someone is asking about a method to calculate family planning commodities. In your case, Eunice, do you manage family planning commodities?
Yes, we do manage family planning commodities, and we request them every 2 months. We do not preposition family planning commodities because they are readily available both at the central medical stores and at the joint medical stores. So we order for stock that can take us for 2 months. So every 2 months we make orders. It's more like a bi-monthly cycle.
Okay.
And yes, there are available tools that we use when we're calculating.
Okay, you have tools to calculate that. And those tools can be shared with anyone? So people can use them?
It's fine, but the tool we are using is from the supplier themselves, joint medical stores.
Oh, okay.
I will share it.
Okay, so it's an institutional tool that the central medical stores use.
Yes, and Greg Roach has also contributed, stating that for FP, for family planning, if you're using kits, there's an associated methodology.
Okay.
This is response. We have, I think, 2 more questions, and then we'll allow you to move on, Eunice. This is lots of participation.
No, that's good
in this.
that people participate. I like that. Yes.
Emanuela asks, how did the PPE burn rate calculator reduce PPE consumption and encourage rational use? Again, how did the PPE burn rate calculator reduce PPE consumption and encourage rational use?
So the PPE calculator was not really to reduce PPE use. The PPE consumption has gone down because of the decreased number in infections, but we use it as a monitoring tool to make sure people do not misuse the PPEs. You know, sometimes when you have stock prepositioning, you're bound to have issues of pilferage.
Yeah, and I think Isaiah raised his hand. Daniel?
Yes, I've asked him to mute.
Yeah.
Yes.
Go ahead,
Yes, you're on, Isaiah.
Hi, all. Yeah, I just wanted to contribute to this question, but the one was.
Yes, go ahead, Isaiah. You're on.
And get the clear understanding. So when we helps the person who is managing the Ppes at the central level with the trend of consumptions vis-a-vis comparing the same with the number of cases on the ground. And over time, one is able to establish that we use a particular quantity of Ppes. And therefore, when you find that the margin between the current consumption and the consumption on the preceding month is having a huge margin, you are able to see if there were misuses. So basically what she's saying is that the monitoring that is being done through the stock status reports using the burn rate tool, that one helps her because she always has a standard or a minimum and maximum level of usage, a significant level of misuse, or there is variances due to changes in number of cases and whatever.
Yes. And with the PPE burn rate calculator, there are other sections I missed. It's able to tell you how much stock was used on a daily basis and how much longer your stock will take you. So if previous it was giving you, let's say, 51 days, and the next time they're giving you the report, it's giving you 14 days, there would be some questions there.
Yeah, there are some other very interesting questions that, well, you know, the PPE burn rate calculator has generated a lot of questions, Eunice. There's a lot of interest in learning more. I'm going to read one more question, and I think that it would be worth it to have a session on the PPE burn rate calculator later. So the question that we have here, and we can forward you the other question so that you can answer to the participants, Eunice, is what are the tracer PPEs in Uganda?
Yes, the tracer PPEs.
Yes.
So the tracer PPEs, we divided them into two categories, the ones for routine use and the ones for the isolation units. So for the routine use, we are looking at the surgical face masks, the alcohol hand sanitizer, the N95 face masks, and the non-sterile gloves. Then for the isolation units, more to that, we have the coveralls, we have the surgical gowns, and we have the sterile gloves.
Okay, great. And is the PPE calculator approved by WHO, or how did you develop this tool? Under what specifications, or is it just a simple tool in Excel?
Well, it wasn't developed by me, but I know it's
Yes.
an IRC developed tool.
Okay.
But it's good. It's really, really good.
Okay. And do you know the One Health tool? Someone is asking if it might be helpful in planning for health commodities, and or if you think that an Excel file would be enough for such planning, for planning commodities versus the One Health tool.
Yes, please.
Yes. Do you know the One Health tool?
Yes,
There's
Laura?
a tool. Yeah. There's a tool called One Health. And someone is asking if it might be helpful in planning of health commodities, or if a simple Excel file would be enough for such planning. That someone
Well,
is asking.
I am not so familiar with, I'm not so familiar with the One Health tool. I need to
Okay.
look it up.
Okay, so we'll get back to the participants when this meeting is over, with the responses and the answers to these questions. So you may continue, and thank you so much for participating. That's what we wanted to do in this session, to make it as participatory as possible. So we appreciate that. So please continue, Eunice.
Next slide, please. So the recommendations conduct a quantification to estimate the required commodities. This can be done during the preparedness phase before the emergency phase comes in. Leverage on your warehousing space in the central locations as well as the field sites. And then you need to make a decision between the higher holding costs versus the purchasing costs. And also one thing to ensure is that the stock purchase should have a good shelf life, since as we know, this is preposition stock to be used in an emergency. So this slide is just the list of the acronyms. Thank you all for your time and for your participation. Thank you.
Thanks so much, Eunice. As you can tell, you generate a lot of interest and questions. There's one question here about monitoring every PPE. Okay, how did you monitor that every PPE and mask that was dispatched was really to put to the use needed, or it disappeared along the way, especially since some individuals only see personal gain and might divert? How do you keep track of ensuring the PPEs reach the last mile and the people who really need them?
I'm going to comment about the face masks because that's where we had the biggest, that's why we've had the highest consumption. But we made sure for everyone who was picking a face mask, they did sign at the facility. So we have all those reports on a monthly basis. So when they would give us the report, and then would look at also the register to see the people who have actually consumed them.
Okay.
So, and this was basically done by the health officers at the facilities, the facility in charges.
Okay. And someone is asking if you had any challenges due to changing program modality?
Yes.
What challenges did you have?
During prepositioning?
Uh-huh. That because of the program changed its objectives, or its it just says wondering if you have any challenges due to changing program modality.
And no, we don't really have any challenges yet.
Okay. Okay, so thank you, Eunice. And then we move on to Bashir, who will share his experience in Nigeria. So welcome, Bashir.
Thank you, Nora. Good morning, good afternoon, good evening, everyone. I am Bashir Yahaya. I'm working with IRC, Nigeria Country Program. Let's share our ideas and experience in prepositioning of pharmaceuticals to the last mile. So the brief overview of Nigeria Country Program. IRC started humanitarian response in Nigeria since 2012, providing aid to over 800,000 people who lost their homes after massive flood in Kogi, north central of Nigeria. In 2014, IRC launched an emergency response in the city of Yola, where IRC provided water, food, emergency shelter, health and nutrition services, informal education and protection services of tens of thousands of people affected by the conflict. In 2019, the IRC expanded its support for most vulnerable populations with several rural health clinics, nutrition centers, and safe spaces for women and children. The IRC Nigeria has offices in Yobe, Mubi, and Maiduguri, with our country office based in Abuja. So IRC Nigeria have like 8 program implementation departments, which are held in RH, nutrition, WASH, WP, CYPD, which is child protection, protection and rule of law, education, and economic recovery and development. So our focus for prepositioning actually is for the health outcome, which is health, RH, WASH, and nutrition. So IRC have around 121 facilities that we are operation sites that we are supporting, with 57 primary healthcare, which are owned by government. IRC is just supporting with supplies and capacity building. We have 6 stabilization centers, which are operated by IRC, and 45 OTPs for nutrition programs. We have 4 comprehensive human centers and 8 mobile clinics, with our 3 referral centers for acute emergencies. So this is just to show the total beneficiaries reached in the FY21. IRC was able to reach up to 1.3 million people in the FY21. And this is just beneficiary statistic by the state and by the sectors reached and by the gender. So IRC responds to world's worst humanitarian crisis, helping to restore health, safety, education, economic well-being, and power to people devastated by conflict and disaster. So these are some of our sites, and as program is going on. Next, please. So let's get to the business. Prepositioning of pharmaceuticals and supplies. So prepositioning of pharmaceuticals and emergency supplies is one of the mechanisms of increasing preparedness for response to natural and man-made disasters. It enables a fast and effective humanitarian response. Generally, in Nigeria, we procure and preposition pharmaceuticals, medical supplies, and watch supplies for cholera, measles, and malaria responses. So this is one of our warehouses located in Maiduguri, Borno State. So the challenges that impede the transportation of pharmaceutical products to the last mile. Generally, the situation of Nigeria, it's more of security challenges and unpredictability of the security incidents that happen. As you can see on my left, the graph showing the security related incidents versus the months. You can see some months have higher, some months have lower. So you can predict when there is going to be an attack. And the most challenging one is the AOGs mounting illegal checkpoints, which are civilians and humanitarian workers are the victims. And during rainy season, generally, we experience these challenges, especially the rainy season in Nigeria is, especially the Northeast, is June to September. And that's every year. In recent years, the trend of significant decrease in government forces on the ground, which has been recorded, and that was the OAGs uses that privilege to mount illegal checkpoints on the road. Other challenges include the scarcity of commodities during the emergencies when the emergency hits, and also increase in fuel prices causes increase in the transportation costs, while for locally manufactured products like infusions, the COVID-19 pandemic affected the Nigerian economy with the instability of the local currency that increases the cost of production and hence increases the cost of products. There's also delays in the getting security clearance because accessibility to the last mile, sometimes we have to get the security clearance from the military before we move items to the last mile. So reasons for preposition of supplies. So it ensures commodity security and risk mitigation against the mounting of checkpoints by the AOGs. So you move your supplies faster, and when it's not rainy season yet for you to encounter such kind of illegally mounted checkpoints. It also supports immediate and emergency response to deploy life-saving emergency supplies in response to major natural or man-made disaster, and mitigate the scarcity of supplies during emergencies. Supplies we normally preposition are pharmaceuticals, especially infusions for cholera. We have antimalarials for malaria cases, also some antibiotics for measles, and water supplies and chlorine for water-related emergencies. So step-by-step process of prepositioning of pharmaceuticals products for emergency response. First of all, you need to, as a first step, you need to identify the anticipated emergency that might occur, because that phase is going to be like your own preparedness phase for humanitarian response, and it covers activities that involves the governments and partners that can undertake prior to possible humanitarian events to make their eventual response faster, more resilient, and more aligned with the needs of the affected population. So developing an initial understanding of your specific threats and potential resources to leverage in is very essential, and that will help and identify the type and quantity of commodities that should be prepositioned. And after identifying that, you need to forecast and do your quantification, then consider if there is budget for that. You budget in your own existing projects, or if there is a new project you are proposing, you factor that in. You also need to consider donor regulations, as many donors have restrictions to procurement of pharmaceuticals. Some donors doesn't allow procurement locally, some do allow procurement locally. So you need to consider that also. You also need to consider the project life cycle. How long is the project going to take? So you don't preposition supplies after the closure of the grants, because many of the projects are yearly basis, except for emergency response projects, which are basically some are 6 months. So you need to build a supplier relationship as well, like to have MPS with them, MSA, you have preposition of stock with them, and maybe agree on a specific delivery lead time to when your stock, when you place an order. Then you also need to consider your warehousing, like the space you have at the warehouse, and the structure of the warehouse, how sound it is, the storage area, is it sufficient and allows proper storage of various categories of pharmaceuticals. And also you need to check if the storage area maintained within the acceptable temperature limits, because if you are stocking pharmaceuticals, definitely you need to consider this, and maybe relative humidity that is required. So there should be a power backup for you to maintain a cold chain if you preposition cold chains for emergency response. And you need to also consider adequate lighting if it's in the stock, so that it will allow for proper maintenance and proper operations of the stock. So after which you need to consider, assess the security context, because in Nigeria generally we experience this challenge of AOGs attacking the supplies going to deep field, and and mounting illegal checkpoints. So you need to factor that in mind and know when is the best time for you to deliver those stock at the last mile. You might even consider like having a common storage facility, maybe at the strategic place before the last mile, so that it's easy for you to access those stock when emergency hits. You need to also coordinate between the government and partners. Like in Nigeria, we have this SEMA, and SEMA it's extended also to states. Is Nigerian Emergency Management. So it's extended to state, which is SEMA, so State Emergency Response. So this one is like a coordinating body to respond to any emergencies. So they have all partners where they meet and discuss their challenges, the gap they have, and what sort of supplies they have, the capacity, and all that. So you need to coordinate, because if there is no proper coordination, you'll find out that when the emergency hits at the beginning, you'll see that nobody is doing anything, while at the end you find out that everybody is doing everything. So proper coordination will allow proper program implementation. Then monitor implementation and progress as the emergency hits. As you are responding, monitor the consumption trends and the utilization of supplies and how the progress of the projects are. Understand some learning facts and challenges, document that for like future programming. That will help you in planning better. So the difficulties with prepositioning and measures taken. So we had challenges of long lead time of our international procurement. As I mentioned earlier, some donors definitely don't allow procurement locally. So what our global pharma team did was to establish a central stock management with two of our major vendors, which are ID and Imres. Then there was a storage challenge identified at Goza, which is one of our LG implementation site at the last mile. So we were able to expand that pharma storage area. There was some poor data quality identified, especially with the government supported facilities. As I mentioned, we have like 56 government supported facilities. So we were able to train them and support them with the tools that we are using to calculate our consumption. And at the central level, we use the pharma inventory tool, which is PIT, to track all the distribution at the field site. So another challenge was sourcing of items prohibited for importation. So Nigerian government has prohibited some 14 items list on the Annex 1 of Nigerian Custom. So, and that generally most of our implementing partners in Nigeria, the NGOs, have difficulties to follow these regulations and also to comply at the same time with the donor regulations. So Nigeria had to invite Quamet to do a local market assessment for us to start procuring locally. So there were some pre-selected suppliers that Quamet was able to visit in 2019. And IRC ensured local procurement and sourcing is done from the pre-selected sources following the Quamet pre-qualification program. So let me just briefly talk about the central stock management. Thanks to our global team who established this program, because the project is very important and actually supported, especially Nigeria country program when we had some challenges back then. So at the global level, IRC has established this with the idea where we have 54 articles with Emirates and 70 articles with IDA. So those, the aim was to guarantee the availability of most requested and vital drugs whenever ordered by country programs. And that will improve our own on time in full percentage and reduce the stock out and reduce our overall lead time. So how the system works is country programs to finalize the list of all items and quantities they need to order prior to priority to be given to those CSM items. Then check the stock visibility with IMRES, because the global team updates us with the stock status of those vendors on a box. So while you are finalizing your list, you have to check the visibility of the available stock, then select the central stock management items based on the availability and the expiry date. Then send your RFQ to the suppliers, including the non-CMS CSM items as well. Then confirm the RFQ and convert that to PO within the 7 days. The good news is it takes like an average of 2 weeks for those suppliers to be ready to ship into the country. So that process actually helps Nigeria in particular.
Great. I have a question, Bashir. You mentioned the long international lead times, but you also mentioned that with the Quamed, you were able to include some local suppliers. So would that be a good alternative, procuring from local suppliers to reduce lead times? And would lead time be a factor to consider when trying to preposition supplies?
Not really, because in Nigeria, we have, in IRC, we have a particular SOP on issue of quality as well. So we have quality assurance unit at the global level. So what we do is, although some donors allow procurement locally, but at IRC SOPs also allow us to prioritize international market first before considering locally, because as you can see in one of my slides down there, you'll find out that we have in developing and in developing countries, you'll find out that there are a lot of substandards and fake medicines available. So not all the items Quamed were able to validate the vendors with. So our priorities was to get those banned drugs from importation to be able to procure locally, while prioritizing international procurement as the first choice, just for quality issues.
Okay, thank you so much.
Hello, Bashir. Oyula is asking if international suppliers can deliver within 2 weeks. And it's a two-part question, I believe. So international suppliers, can they deliver within 2 weeks, or what is the timeline for that? And the second part is, is it challenging to find local suppliers in Nigeria? Your warehouse is in a far area, so the suppliers aren't that close to the warehouse. Do you order samples for each item to check it visually before you proceed with a PO?
Pardon, sorry.
Yeah, so the first part was international suppliers, can they deliver within 2 weeks? Let's start with that.
Yeah, so for the stocks available in the central stock management, they will be able to make that stock ready to ship within 2 weeks. However, when it gets to the country, it takes like around an average of 8 working days for us to clear them from Abuja airport, then transport them to the field.
Okay, great. And then quickly, with regards to finding local suppliers in Nigeria, how difficult is that? And then second part of that, if you have suppliers that are far away from the warehouse, do you order samples for each item and then check it visually before you proceed with the PO, with the purchase order?
Okay, the first part, yeah, it's very difficult to find suppliers that meet the international standards locally, because we in the first process of the Quamed process, you need to identify suppliers and do some comment processes before even inviting the comment. So the process was to screen those suppliers and see who have the required information for even visiting. So we were able to get up to 32 suppliers, but Comment was able to just do 6 out of those 32 because many of them don't meet the standards. So it's quite challenging for you to get that in country. The second part is about the supply. Yeah, our central warehouse is located in 3 states, one in Yobe, one in Mubi, one in Maiduguri. So what we do, for the local procurement, what we do is if we are procuring locally, so we send of our RFQs, not checking not checking visually what the quantities are or the product is, but we will mention the specific company that we want for the products, and we will ask for the certificate of analysis of that product, and also ask for the GMP certificate of their sources. So then after that, when the supplier is contracted to deliver at our own warehouse. So when it is being delivered at our own warehouse, we'll come and do visual inspections and see if they are in conformity with the documentation and preconditions you mentioned before even issuing the PO.
And there's another question, Bashir. Did you put in place any preparatory activities to speed up the import process?
Yeah, that is one of the establishment of central stock management project is to fast track all our international procurement to reduce the lead time.
Okay, great. Okay, you may continue, please.
Okay, next slide. So the outcome of our prepositioning this year was IRC is able to support the government with supplies to respond to cholera in the established CTCs in Yola Specialist Hospital, Lamorde and Numan General Hospital is in Adamawa State. Also, IRC was able to support with the establishment of CTCs in Bama, IDP camp, and established 4 RP points in Bama, Borno State. IRC was able to respond to a surge of malaria cases among returnees in Bama through emergency mobile clinics. IRC also supported with supplies to respond to 32 CTCs in Damaturu, Pataskum, and Jakusko, established 19 ORP points, all in Yobe State. IRC was able to overcome the scarcity and hike in prices of infusion, especially Renga selected in August. The prices went high, and I also got the information that even if you have the money, you hardly get the stock in such, while we still have them in our own warehouse. And we're able to like respond to many emergency response, especially cholera, with our supplies in Pulka, which we preposition in Guza, which is only 18 kilometers away from, but it's very challenging for you to reach that. So that was why we preposition in Guza for Pulka response. So IRC was also able to like overcome the delays in the security military clearance getting with during the surge in malaria cases in Bama. So my recommendations based on experience is, first of all, you need to identify the context specific of the emergencies that will be required the response, and identify the target groups that and the common morbidities in the proposed area of intervention. Then you also need to train staff ahead of even the emergency for data quality and program implementation. Then build a forecast and do your supply planning based on the logistics data or based on the previous experience that you have. Then at least use one or more, more than one data so that you will have better forecasting. Include the cost in your budget proposal, build your relationship with suppliers, and identify the storage facilities and make sure those storage areas have the required facilities to suit the kind of products that you are about to or you want to preposition. Develop coordination between partners and implementing partners and MOH, especially the MOH, because they are supposed to be the leading partner in every emergency. So it's very important to involve them in any discussion, and if possible, have them lead the coordination of the response. Do risks and security assessments as needed, monitor the implementation and progress of the program. So my last message to all medical logisticians is you all have a global, a goal to just provide commodity security and improve program impact. So quality of care and cost efficiency. We must convince policy and decision makers to invest in supply chain to increase overall program effectiveness and improve health outcomes. We must show them that for any public health program to deliver high quality, comprehensive services and ultimately improve health outcomes, a robust supply chain for managing health commodities must be in place so that we can achieve all that. Thank you very much. And I indulge you to have a 3-minute video watch for our Al Jazeera visit to one of our stabilization center in the Mashamari here in Maiduguri. So these are the list of acronyms that are in the presentation slides.
Thanks so much, Bashir. And like Eunice, you generated a lot of questions that my colleagues will help us read and so that you can answer. So this has been great, you know, because we have given the opportunity to people to ask a lot of questions and learn from both experience that you have shared with us today. So we really appreciate your insights and the last message to the medical logisticians that's it's really important for all of us to think about how important it is the supply chain and how everybody works towards the same goal. So if Daniel and Annabella can help me read the questions that are out there in the chat.
Yes, Nora, there is one question for Pacific that says, how do you manage traceability of drugs from your warehouse to health facilities? Do you use any software in your warehouse to manage stock?
Yeah, so we have a tool called PIT, that is the Pharma Inventory tool. So that will help us to track the distribution to each facility. So it captures the quantities, the batch number, the expiry date of all the stock that you are distributing to all the facilities. So they are Excel-based tool.
Okay. And there is one question also. How long does it take to purchase non-CSM items?
So it takes average of 2 months for you, because the vendors also needs to order. What is not in the CSMS is if it means they have not prepositioned that one as well. So they also need to order. So it takes a minimum of 2 months before you get the stock.
And I think this question was also pending. Do you collaborate with other INGOs for exchange, donations, and borrowing of stock to prevent out of stock, to prevent expiry and waste as well?
Yeah, definitely. We have a logistic cluster group for all implementing partners that are implementing health, and we do meet frequently before the pandemic, but now we are doing a virtual meeting. So we have those structures that we do collaborate with all the partners implementing in Nigeria, especially in Maiduguri.
Okay, and I think those are so far the questions that are. I hope I didn't miss any because these were in the chat part.
Okay, yeah, and if we did, we will try to get back to you all and get the responses. As you also know that there were a lot of interest around the PPE burn rate calculator, which I understand Bashir uses as well in Nigeria. So yeah, we will get back to you and probably we will think about having a short session on how to use it at a later date, probably next year. So I think Nadia would like to say something as a wrap up.
Oh, thank you, Nora, very much. Thank you, everyone, for staying a little bit extra so that we can answer all the questions. We really appreciate your participation and the excellent questions. And, you know, we wanted this to be less official and formal than some of the previous webinars so that we could have more discussion as we go and learn from each other and continue to build up this wonderful community that we're very excited about. And we really wanted to have people from the ground, from the field, talking to us and teaching us rather than having people up here in the headquarters teaching. And so we're very pleased with this and very, very thankful to IRC and Eunice and Bashir for this participation, because we know you're very busy and we know it's always a challenge to get people from the ground to participate given your very important priorities. And also I'd like to thank Wambui, who's also on the team of IRC and answered a lot of the questions and is always very supportive as well of this work, and Annabella and Nora and everyone. So thank you very much and have a wonderful day.
Thank you. And Asaya, I think, has raised his hand. So go ahead, Asaya. Okay. Okay, Asaya, go ahead, please.
Hello there. Yeah, actually, this hand was the former hand addressed to contribute to Eunice's presentation. Otherwise, I did not have another contribution. Thank you so much.
Okay, thank you, Asaya. So nice to hear your voice anyway. Okay, so thank you very much. And we just wanted to announce that on November 18th, we will have another technical meeting similar to this, where we will talk about local versus international procurement. And we will have a couple of speakers from the field to share their experiences. So stay tuned for that announcement. And again, as Nadia said, we really thank you for staying over past the hour and for participating lively in this technical meeting. So until next time, and thank you very much, Bashir. Eunice, very, very thankful to you for your presentation. So until next time, bye.
Have a great,
Thank you. Bye-bye.
have a great day. Thank you.